Hi, welcome to our channel Capsule Tab, and today we would cover an antibiotic which is called levofloxacin, and here we are gonna to cover almost all the details. So let's start. So the first we will see the dosage form. The levofloxacin is available in the form of a tablet of a 250 milligram, 500 milligram, 750 milligram, and levofloxacin is available as a oral solution, ophthalmic drops also for the eyes, and the IV injections are also coming of levofloxacin. And the second thing is we will see the trade name or brand name. So the generic name is called levofloxacin, and many different companies they used to sell the levofloxacin with their trade names or brand names, and the major brand names are Tavanic, Gravit, Aliquin, Floxil, Levox, and in India we can see the levofloxacin is available with the brand name of a Final, Levoflox, Lefomac from Macleod, Alcin, Glevo from Glenmark. So these are the major brands which is available in the market. Now we will see the levofloxacin history. And levofloxacin is basically a broad spectrum antibiotic, and it is a third generation of the fluoroquinolone. And levofloxacin is available in the World Health Organization's list of essential medicine list. And the next one, if we see, the levofloxacin was synthesized and developed by the scientist at a Daiichi in Siegia, and levofloxacin was patented in 1985, and then it was approved for the medical use in United States in 1996, and it was first approved for the marketing in Japan in 1993 for oral administration. And the company Daiichi marketed it under the brand name of a Cravit. Indication of levofloxacin. Indication are the condition where the doctor used to prescribe the levofloxacin salt, and the major bacterial infections are two types where the doctor used to prescribe the levofloxacin, and those are RTI and UTI. RTI means respiratory tract infection, and UTI means urinary tract infection. This is the full form of RTI and UTI, and the major RTI infections are acute bacterial sinusitis, chronic bronchitis, nosocomial pneumonia, community acquired pneumonia, and other than this there is a complicated skin structure and uncomplicated skin structure infections. In both the condition doctor used to prescribe the levofloxacin. And the next one is the UTI. In UTI the bacterial prostatitis and complicated urinary tract infections, uncomplicated urinary tract infections. And other than UTI there is a condition like inhalation of anthrax, meningitis, the pelvic inflammatory disease, or traveler diarrhea. In condition of tuberculosis and plague also, the doctor used to prescribe the levofloxacin. Mode of action of levofloxacin, and mode of action means how any drug works in our body. So the levofloxacin is basically a bactericidal antibiotic, and bactericidal means it kills the bacteria in our body, and to kill the bacteria it inhibits the DNA gyrase in susceptible organism. So thereby the levofloxacin inhibit the relaxation of supercolloidal DNA and promote the breakage of DNA. So the replication or repair or recombination process is stopped and the bacteria is killed. Here we are not discussing the dose because doctors are the best trained to prescribe the dose according to the symptom and the condition. And the next topic here which we will see is the contraindication. Contraindication is the condition where the person should not take that medicines if he is having any kind of a history of epilepsy, or any history of a tendon disorders, or he is having any known hypersensitivity condition. So in that condition he should not take the levofloxacin. And as we are already aware that every medicine is having few kind of side effects, so if it is mild then it is okay, but if the scene becomes worst then it is better to take the emergency advice from the doctor. And the common side effects which is attached with the levofloxacins are nausea, vomiting, diarrhea. Few patients feel headache, constipation, or difficulty in sleeping, some kind of a dizziness. Sometimes people may feel the abdominal pain. So these are the common side effects. and the next is a drug interaction. Drug interaction means the yani with which medicine you should not take the levofloxacin. If you are already taking any kind of iron salts or magnesium or aluminium containing antacids, then you should avoid the levofloxacin, or you should discuss it with the doctor. So these are the basic information about the levofloxacin, and we will cover another antibiotic in our next video. Till then, bye.